Welcome to FSHD Straight Talk, the podcast where we dive deep into living with FSHD. I'm your host, Tim Hollenbach, and I'm on the journey with you. Having FSHD, I understand the challenges it brings to patients and their families. We're in this together, and this podcast is a space where we swap stories, share advice, and talk to experts to get the latest news. There's plenty to say about living with FSH muscular dystrophy, so let's get straight to it. Welcome all to another episode of FSHD Straight Talk. I'm your host, Tim Hollenbach. Thanks for being here. It's the show is being recorded right before Thanksgiving, so I hope when you're listening to it now, maybe you had a great Thanksgiving with your family, and we're ending the 2024 year. It's just right around the corner. Holiday season, and then the year end. If you want to get a hold of me, I'd love to hear some of your show ideas. I'd love to hear your feedback on the show. Like it, hate it, let me know either way. I can take it. FSHD Radio at fshdsociety.org is the best way to get a hold of me there. I've had some great emails with some ideas for shows and guests, and I'm always working on trying to get new people in here. The show is about the community. In the past, the show was about the science as well, which this still does touch on that. Of course, it has to. But really, the community of FSHD, either the people that have the disease, family members, those in the trenches with us all, trying to find a cure for this thing. That's really what this show is really about. So I really appreciate the listenership throughout this year and all the years I've done this show. It always is a reflection this time of year for me to look back and go, what is the show started at the beginning of the year? What does it evolve to at the end? Or even in the very beginning, from my first guest with Jun Kinoshita in our first episode. But you can find all of them at places you find your podcasts. I actually think I noticed it was on Amazon too, where they have their podcast. So that's kind of cool. Pretty much anywhere you can find podcasts, you can find this, what I think the community makes it a great show. The community does, FSHD Straight Talk. So I'm very gracious to the community for listening, being a part of the show. The guests that come on means a lot to me. Today's episode, I guess I want you to imagine if there was a platform for you, only you, the community of FSHD people. It could track your symptoms. It could customize resources just for you to access, information tailored specifically to your needs and symptoms. Imagine that. Imagine clinical trial matching. I don't know about you, but sometimes I get a little lost on the Gov site. Like, where am I going to go? How am I going to find about this? I feel like I'm always a little late to the show. And imagine that it was secure. The data you give it, it's secure, locked tight. Imagine if those things were in this world. How could it help change? How could it help find a cure? All that data. DNA tests can be logged in there too, and they're on the ready for you. Maybe at some point you can even print out your information or give it in some other type of form to your doctors. You don't have to keep re-explaining the things that have happened to you over the year as you visit them yearly, like I do. It's not a fun visit. So this would ease that, right? Does it exist? Is it out there? Yes. Yes, it is. And I know you've heard about it if you're taking the time to stay tuned to social media of FSHD Society. It's BetterLife FSHD. Great, amazing title for it because that's its goal, is to give you a better life. I've tried the platform. I've logged on. I've answered the questions, seen all the things that it is capable of. And I think it's fantastic. It's not complicated. It's simple. I just did it on my phone, answered some questions. But I don't want to go too far in the explanation. In this episode, we are bringing in two guests that are basically spearheading this. Amy Bekier and Kayleigh Worek are the people that are spearheading this. Amy was a part of the focus group helping design it. Kayleigh is managing it, engineering it, part of the brains of the operation. And this conversation takes amazing turns in directions on what this simple platform can do for you as a person, as an individual, as a community, to help build a robust data platform on the ready, and also giving you what you need now to help you through the rough days of this disease. Where do you find a doctor? All these things. We are going to tell you what this platform offers now and what it's going to offer very near future as well as it keeps growing. It's a robust conversation. It is a deep conversation with fun twists and turns of all the things that Better Life can give you. I'm excited to bring it to you. You want to learn more, you want to hit pause, go to fshtsdsociety.org, BetterLife. BetterLife has its own site as well. We're going to plug that in this episode. And then once maybe you look at it, then maybe hit play again and then listen as these guests explain it even in better detail than I ever could. That's why I'm so glad that they join us on this episode. So enjoy this conversation about this awesome platform that is out now, BetterLife FSHD. So, as promised, the great guests that we have here in this episode is Amy and Kayleigh. We are talking about the big thing that got launched. If anybody got the Advocate, it's there too. I hope you saw it. Hope you read about it. It's all over the website. It's BetterLife FSHD. It's I guess a platform, but I'm not going to go even further from that. I want the people here to talk about it to start with and explain it to us. I'm new to this too, everybody. So I got some questions as well, and we're gonna have a good conversation about what this is all about. So, Amy, Kayleigh, how do you want to start? Who wants to go? What's this about? Tell us what is Better Life?
Kayleigh, why don't you introduce the Better Life?
Yeah. So my name is Kayleigh. I am the program manager for BetterLife. I actually just started in August, and we kind of did our launch of BetterLife in August. So we have a lot of amazing stuff that's ready on the website now, and we also have a lot of incredible things coming in 2025. And as Tim mentioned, it is an online research platform. So it is a website. You can access it on your computer or on your phone. And it is a place that people can go to start to enter survey data. And the way that the surveys are designed is they have a lot of benefits to you. So the first kind of set of surveys is what we can kind of consider your research ready surveys. And these are going to really help do two different things. One is as you start to answer questions about your health history or any symptoms you're experiencing, Better Life, the website, will actually start recommending personalized content based on your answers. So, for example, if you indicate that you have sleep apnea, you'll actually see tailored content from the FSHD Society website directly ported to you about any symptoms you might be experiencing. And so it's really easy to kind of get the relevant information that's important to you based on the symptoms you're having. The second thing that starts to happen once you start filling out these research ready surveys is that they actually will enable us to help match you to research opportunities. This will also be done in two different ways. So we have already companies or other researchers reaching out asking for some people who fit certain criteria. And we're able to look at the data that you enter and say, oh, and we'll reach out to you and say, are you interested in participating in this research opportunity? And then we also have a more formal research opportunity matching that's coming out in December, which will be a list of all the clinical trials in the US. And it will kind of show if you are a good match or a possible match or a bad match, or maybe not a match for certain trials based on your age or maybe any symptoms you're experiencing. And so those surveys really, you are providing us information, but then we're using that data to provide you information as well. And so this information that you enter will also become research data that researchers and other companies can request to look at in a de-identified manner. So it really fills the pool of research data we have on people with FSHD. So that's one small portion of what Better Life does.
Right. It's like you almost said that in one breath. That's how much information there was there that like the back of your hand. That was impressive. It was impressive. And the first thing though that comes to my mind, and I'll guarantee this is someone that is thinking this right now, because you use terms like your information, you're filling this out, your stuff. Somebody out there is saying who has access to it? Are they gonna, manipulate it somehow? Could it get, hacked? And we all hear about these nightmare stories. So I think the first thing, so we can kind of put everybody's mind at ease, is the security. Because I think if we address that, then the rest is like a flood of people signing up. Oh, it's secure? I'm in. So where is that, the security level? Like what's being done about that?
Yeah. So I'm not a huge security person, but I did take a few notes.
Yeah,
um,
yeah.
So the databases that the information is stored on are all encrypted. And the company that has created this website, Lumio, they follow all global and US safety and policy,
Nice.
like privacy policies. So they do regular security audits. They follow SOC 2 and AES, which are cybersecurity frameworks. So they are very um, on top of all the latest security measures. And if you want to know more on the Better Life website, there is a frequently asked FAQ section that
Okay.
that's just privacy and security. So if you really want to do a deep dive into those questions, they're actually all on our website.
Correct. And as you're talking, I clicked it in 2 clicks. So people, relax. They got it covered, right? Like for the betterment, I understand we have paranoia out there too, and I understand we live in that kind of world. But full disclosure, like I did this like a month ago when it was kind of launched. I was really intrigued. I'm a really kind of survey nerd too. I like seeing that kind of stuff and then that kind of data. And then I went into it last night knowing full well we're gonna record this. I was like, I should jump back in there and see, I guess, like what I have to do. And I guess that kind of was one of my questions. Like how often should a person be like logging in? Like are they being prompted to do that? Or is it just like when they feel like it? Like how is like the flow, I guess?
Yeah, that's such a good question. As I mentioned, right now we have surveys available. And
Mhm.
so it's we want people to not be too burdened or stressed out or fatigued by taking these surveys. So you can
Mhm.
kind of self-pace these.
Mhm.
So you can log in and do one survey and then log out. You can log in and do all the surveys. You have, once you start a survey, we ask that you finish it in about 4 weeks, which is about a month,
Mhm.
just so the data is fresh in your mind and it's all from one kind of time point. So we will send you email reminders of like, oh, you started the survey, and we'd like you to finish it, in 2 weeks or 1 week. So we do send little survey reminders like that. Once you go in again, and the more questions you answer on the surveys, the more of those insights and recommendations tailored to you that you'll see. Um, and then we're actually launching a lot of new features that we hope will bring people to the platform even more. So one current feature is that you can actually track your symptoms daily. So we
Mm.
ask about pain, muscle weakness, and fatigue, and you can track that on a 0 to 10 scale, and it'll
Mhm.
keep a log of it every day. So you can look at it over the past 2 weeks, past 30 days, or over a lifetime. So you can log in as often as every day if you'd really like a place to kind of keep all that information.
Yeah.
And then the latest feature that we just released is called community polls, which these are questions that kind of come from the community. And you can kind of see everyone's answers in real time. And those are updated every 2 weeks.
Oh.
So it's kind of a choose your own adventure at this point, in that we want you to be engaged in using it as much as or as little as you'd like.
Mm. I like the way you said that. My video game brain went right to it. Choose your own adventure, right? I mean, that's simple.
Uh,
And this is where I was going to ask Amy, like about the simplicity, because you were on the focus group of this, Amy, right?
yeah, correct. Yeah, I have been since the inception one of the patients in the patient advisory focus group. How does it look? What visually is it pleasing? Should this be on the left or the right?
Wow.
Where would you want it? What do you want to see on there? What are you looking for? And from the patient point of view, this is a win-win. It's a recording tool for
Mm.
patients to document their own FSHD symptoms, while also providing researchers with the data to analyze anonymously. So it's going both ways. It's not only what's in it for research and outward, it's also coming inward for yourself. Are your symptoms, are other people having similar symptoms? Is it me? Am I crazy? Who else can share this? Who's at this stage with the disease, the frustrations, the joys, and communication? So it's connecting patients to clinical trials, connecting patients eventually. We hope that they'll be connecting to each other. At
Mm.
this point, they're
Yeah.
still working on that. Providing personalized resources because everybody is at a different stage
Mhm.
and has maybe some different needs, although we all have many of the common same issues. And tracking our own symptoms over time and then being able to share that from one place push a button and share
Mm,
that with our own medical professionals,
mm,
as opposed to having to sit down with a 40-page form and fill it out and re-educate every one of our medical professionals. So it works both ways. It's coming information coming in
mhm,
and providing information to help going out.
mm. It's
Did I say
exciting
that
too.
right, Kayleigh?
Yeah, I think that was spot right. Yeah. It was uh, it was simple, to Amy's point, and I love the fact that you were in there, Amy, because when you even down to the gritty details, it sounds like left and right and where to click. It was very simple. I did it on just my little phone, not a problem. And there are even like, for example, of questions. Like it's not is it just physical type questions they're asking? Is there like mental health questions in there? Can you give an
Yes.
example of like where those go? I mean, not where the answers go, but like the direction of the questions, I guess.
Yeah, and I did want to highlight a point that Amy also mentioned regarding data privacy and
Mm,
security, in that we hope to make this data available for researchers, and that research data is de-identified, which means if you fill out a survey about your pain or any progression or your symptoms, when that research data is shared, your name and any personal identifying information is taken out. So they'll just know general information, like this is a female who's having these symptoms, but they don't know it's you, they don't know your birthday, they don't know where you live. And so uh, we ask, like I said, kind of different groups of surveys. The first one is like really the research ready surveys about basic demographic information, kind of diagnosis details. Do you have a genetic test? Which type of FSHD do you have? If you know, family members,
mm,
common symptoms, progression information. And then once you finish those and they're done for kind of a year. And
mm,
so in a year, if anything changes, you can go back in and update it. But that's the kind of like baseline data that we get. And then one of the other things we do is after you kind of finish that set, you'll start to get quarterly symptoms about pain, sleep, fatigue, daily activities, and diet and exercise that we ask quarterly. So that way we can really get a good insights and tracking into how your progression is over the year.
mm.
And so that's another kind of set of questions that we ask.
Nice. So it kind of knows what to ask and when based on quarterly and so forth. And all you do is log in and it just prompts you answer these. It does also say how many minutes roughly it'll take, which I think is nice. It took me a lot less than the minutes that it says. So, just so people know, it's doesn't
Yeah,
take
and you
a lot of
will get
time, so you're secure and it doesn't waste your time. These are the things that I think are key for anybody that's new to this or skittish. I think those are the biggest questions they're going to have, right?
and
Yeah, go ahead.
do occasionally send email reminders when something new is happening in the platform.
Mhm.
Uh, we like to alert our users via email and say, oh, come back, here's this thing that's open, or this is a new feature we just launched. So we are definitely communicating with our users as we're launching new features to bring people back in. Because yeah, some people might have created an account a long time ago and they're like, I logged in once and I'm kind of done. And so now we can be like, oh, there's all these other things coming. You can come back in.
Yeah.
And
Yeah, they
this,
got to keep coming back.
Mhm.
Yeah.
And there is a critical mass number of participants that are necessary.
Mm,
So we are really encouraging everyone uh, to sign on and start putting your data in, because without that critical mass, um, you can't get the reliability and validity of the information, the
mm,
polls, the data, the surveys.
mm,
And the more we have people filling those out and the more valid they are, the more the scientific community can
mm.
find value in them. And there's power in numbers. So really is important to do that.
What do you think are the biggest hurdles thus far in kind of launching this, getting it going, getting people involved?
I mean, we had really amazing interest and participation at the outset. And I think one of the things that's hardest for me as a person behind the scenes is knowing how much exciting features we have coming down the line, but that aren't released yet. And so I think I have heard people say, "Oh, I logged in and I thought I did everything, and so I haven't really been on." And then we released community polling, like, a few weeks ago, and that's active and can bring people back in. And as I mentioned, our clinical trial matching, or our kind of research opportunity matching, is we're kind of building it and testing it right now, and that's going to be released by the end of the year. And I think one of the biggest hurdles too that I'm seeing is one of the ultimate goals for Better Life is, as Amy mentioned, when people put in their data on their progression, is that we would like for you to be able to export it as the
Mm.
person whose information this is about. We want to give it back to you in a way that's simple and easy to read, and that you can then hand to your doctor, and say, this has been my progression. And so that's something we're developing in 2025. And so we want to hear from you. What do you want it to look like? How often do you want to
Mm.
get it? What format does it need to be? And so that is, we kind of need the data in there first, and then we can provide you with that. And so that's a thing we are working towards, but don't have yet. But I think is something that this community is asking for. They're like, I don't want to put my data in a black box anymore. I want to see it now. And that's the need we're really hoping to fulfill in 2025.
Good things coming down the pipeline. I mean, that's right around the corner, and we're into December almost here. Wow, that's great.
Maybe into
Yeah,
2025, some point in
yeah,
2025.
it's very dynamic is the only way I can think of it. It's fluid. The Better Life has the ability to change, add, subtract as we see it develop, as the masses of FSH patients, families, the more sign on, the more we'll understand what the community needs, what they're looking for. So we're urging everyone to sign on. And for children, the parents and guardians will have control over it. So it is very, very important. I've said it numerous times already. Critical mass. We need that in order for this to be the true success that it deserves to be.
And
Is
Amy,
it, go ahead.
oh, I think you brought up some really important points that I did want to chat about too, just about who we're looking to enroll and who can join Better Life. So it is just for people in the US right now, ages 1 and older. And as Amy mentioned, if you are maybe a child or a minor with FSHD, your parent can actually sign up for you and create an account. If you maybe have a mom or a dad who doesn't really get on their computer, they can make you an account and add you as a delegate so you can log in on their behalf and help them with the surveys. And so it is very flexible as far as really helping people access this resource. And that's kind of a little bit about who is also eligible. So
Mm.
sorry, Tim, continue with your question.
Well, I was just gonna say that that's exciting to get the youth involved. That's been one of the pushes I've tried to have that part of our community on more often in this format, even just to kind of get it more and more on the radar, so that they're not being left out of those clinical trials as they start to formulate more and more. Um, the
Kayleigh, I have a question. Is it going to be a way for or not, depending on the person's attitude, to have a link with families?
Yeah. So right now, the way to have a family per se is maybe I'm an adult with FSHD or without FSHD. I can add children to my account. And then when they turn 18, they kind of take over their account. And so our family structure is set up in that way, really for guardians and their minors. And then, as I mentioned too, we have this kind of delegate option. So maybe it's a husband and a wife, and they're kind of tag teaming, tracking things and filling out these symptoms. And so you can kind of link people and allow people to access your profile as a delegate who might be a husband or a wife or a grandchild or something that's not a guardian/parent minor relationship.
What do you think the main problems this is going to solve? Yeah, right. I mean, because I come from I'm also a small business owner, and we always say, what is the problem we're trying to solve? Is it the community problem? Is it, for us, it's easy. I mean, we're in the baseball business, so it's like, problem we're trying to solve is unhappy families. Okay, well, let's try to do that. And we know that, I mean, that's a big question. I get it. It might not be one thing, it might be multiple things. But in all, right, this was developed because there must have been some problems existing, and we need to create a format the great minds behind this and said, this is maybe what it looks like. Did I
Yeah.
stall enough to help you kind of think a little bit about that?
Oh,
I get the meaty
I'm so
question.
excited to answer this question. Because there's so many things that we hope it's going to solve. And as you can tell by the name Better Life, that was actually developed in a focus group when we're really hoping that this can be your kind of one-stop shop of how to live your best life with FSHD. If that, okay, I have FSHD, what should I do? I go to Better Life and I learn about the clinical trials. I log my symptoms. I track my progression. I add my family. I'm contributing to research data. But also I am getting these personalized article recommendations based on my symptoms. And I am asking, as I mentioned, community polls, I'm asking questions to my community members that I'm curious how I compare, if anyone else has heard of this thing or how anyone deals with that thing. And so one of the other things that we hear as a big need in our community is to find knowledgeable providers. And that's another tool that's actually under development that we haven't released yet. It's, again, a 2025 project, is to kind of be able to see a map of providers around you that have been recommended or resources that are around you. Because this is a big issue. We have people reaching out to us like, I need a good PT, or I'd like a neuromuscular specialist that already knows about FSHD. And so this is another need that was identified in the community and is going to become a part of Better Life. So a lot of different needs that I think we're tackling.
And as a patient, also, Kayleigh mentioned before, that you're not going into a black box where you're an oddity and no one knows but you what you're going through as a rare disease, and that it's a community, so that we can then compare and contrast with the others and relate to other people who are going through the same thing.
Yeah, community's key. That's what I've learned for sure. And see why we changed the direction of the podcast. Like, science is great. That's all a lot of fun. Yay. And I take a lot
Exactly.
of time
Yeah,
talking
I
to
mean,
scientists.
you were
Let's get
asking
community.
about mental health before, and
Yes,
that's a
yes.
very, very important key. They always say family,
Mhm.
friends, community. When you're feeling alone and that no one else can understand you, there's a tremendous burden, mental health burden to that.
Mhm. Yeah, and that addresses that, right? It addresses that problem. And it's not necessarily that you're searching for solutions, but you are searching for answers or things that people can use to help. You know,
And hope.
you're right.
Hope. I mean,
Yeah.
what's the ultimate goal? The ultimate goal here is to find a treatment or a cure.
Yeah.
And, without hope and without keeping on top of what's happening, there's a tremendous amount of exciting things happening right this month.
Mm.
One of the pharmaceuticals was just bought out by Novartis, which is Kate Therapeutics. Novartis is huge with deep pockets, very, very interested.
Mm.
I just got a couple of emails across my desk at a couple of other very large companies who are doing partnered strategic partnerships, all in the FSHD and genetic arena. Well, how do we know about these things? If you stay connected. Otherwise, you feel very isolated and feel that you're kind of cast into the wind. And this is a grounding. It's information is power, empowerment, and advocacy.
Hmm. Absolutely. Yeah. Well put. And I love the hope. Hope can be a powerful tool. Is there anything like this in any other, you know, uh, disease group? I don't know how else to say it, right? Like that, this kind of platform, because I've never heard of anything like this before, where the community is like this interactive with the disease itself and community and the whole thing.
I can't think of one. It's a very unique platform. Again, it kind of had the bones of a patient registry where you are submitting um,
Mm.
surveys that
Yeah.
become research data, but then we're the only people that we know who are then really using that data to help you back. I'm not sure of any other platform I know of that's doing that right
Mhm.
now.
Help you back. I like that. That's a good phrase. Yeah. I'm always searching for nuggets in my podcast here, and I like that. Help you back. That is the impression I get. It's almost like, man, it's almost like you're talking to AI a little bit, right? How how there's so many commercials. You can talk to your phone now and have a conversation with it. And it can ease you and answer questions and this and this. And it's very much not just, hey, we're answering questions and this helps our community, but it's helping you kind of navigate, it sounds like, in essence, when it comes to finding the right PTs, doctors, community, kind of a one-stop shop. Is that the ultimate goal?
Yeah, it's to be where you go. I know I hear a lot from people in this community who have been, diagnosed for a long time, and they used to just kind of say, "Good luck out there. I don't have anything for you." And this is the like response to that of being like, "We have an entire website for you that is full of features and is tailored to you and is going to be tailored to which research opportunities and is going to contribute to research and is going to help you connect a little bit with the people who are also going through this." So it was a bit of a response to that of being like, we're gonna make this amazing website for you to access that's gonna have everything you might want as a person now living with FSHD.
Mm.
And I do want to stress, because people are impatient and they want everything now, to please be patient. As I mentioned before, it's dynamic. Not all of these things are live yet. They are coming, and as needs arise that can fit into the platform, there's no reason why they can't be added in the future. But we've got to be there. You got to be in it to win it.
Mm. You
Absolutely.
talked about a number too, Amy, that you're trying to hit of people logged in and like being a part of this. Do you know how many are roughly involved in it now or logged in and doing it?
Kayleigh, I think you would know.
Yeah, I think about 350.
350. Okay. And then
We
like
love
what would be that magical goal? I'm a big goals guy. You know what I mean? Like, what's our goal? Okay, how we get there?
about 1,000.
A
That is
thousand. Okay.
1,000 US.
1,000
1,000
US.
US. Yeah. Yeah.
But eventually they want to do this globally. And the reason we want to do it globally is because, again, the pharmaceuticals are not border dependent.
Mm-hmm.
They do things all over the world, and scientists are all over the world that we're working with. So to be exclusionary and only do the US would be to really be locking out the brains of the entire globe. So eventually, and we would love to have globally a minimum of 5,000. If you
Oh,
want,
that's easy. We can do that. For the globe? Come on. That's all you got? 5,000? Come on.
I'll hold you to that.
Yeah.
We'll piggyback off of Amy's point too, which is we have heard even in the few months that Better Life has been live, people in other countries saying, "I want in. Why is this
Uh,
not for me?"
yeah.
So we do know that that's a need, and the short answer is because the regulatory laws for clinical research are different in every country, and we have to abide by every country's different research laws. And so we started in the US, and we are looking again in 2025, which is just around the corner, about what it's going to take to be in different countries. So we have not forgotten about the rest of the world. We will get there.
Now, I
And,
definitely want to
and
make yeah.
I'm sorry. I just want
Mhm.
to say the other beauty of that is that what happens right now is there are many different registries all over the world. Problem is they've all been designed into their own little universe. They
Mm,
can't talk to each other.
mm.
So you have patients in one registry. Even here in the States, you have the Rochester registry, and it cannot be called by a different other registry. When you're all in one registry where you can, or a registry that can communicate with the other registries, you can then have much truer data coming out of it.
Yeah, that and the fact that those don't seem to, I'm going to steal your phrase, help you back. I mean, to the point of this does. I mean, if you're telling me that I can put my information and then it says, hey, you answer these mental health questions maybe like this, and please correct me if I'm wrong on this like analogy. And boom, here's like and this is in the future. Here's some possible resources you could use if you feel like you need that help, right? I mean,
But that's right now. That's a feature that
yeah,
it's
that's right now. Wow. I mean,
Mhm.
that is huge to me because I wasn't even handed a pamphlet when I said I had this. So I was like, oh, all right, I guess I'm leaving. I guess I'm going home, right? So here's it is. It's a little bit of hope. It's a little bit of help. The big question, though, I know I can hear it now. Does this help find us a cure? What do you think?
That's the goal.
That's the goal. Yeah.
Yeah. I mean, we need people to participate in clinical trials to create cures. And when there is a clinical trial that's going to the FDA, if we can even have the data and say, look, FDA, here's, people who have been on this drug and their quality of life improved, or here's people who already have a genetic test. And the hope is that we can use some of the data in BetterLife to also petition payers in the FDA of like, yes, this therapy is very needed. That's another reason that BetterLife was built, is to like be that kind of stepping stone into that next step. And even what's considered post-market research. So even after a drug is approved, pharmaceutical companies still have to research it, and they have to continue to monitor people for years. And again, if they're already a part of BetterLife and we have that before data and maybe we have that after data, again, it's going to support the whole structure of drugs even after approval. So that is the hope.
That is exciting. I like the sound of that. Yeah. So, before I let you guys go, I want to make sure that we're going around, as I call it, around the Zoom, not around the room, to make sure we didn't like miss anything. I know there's like a huge unpacking of this. Is there any point or things that I messed up on, didn't ask you the right question, and we missed something? Because it's like it's almost borderline overwhelming to some degree of how robust this is, and I think people need to take a hold of that and like grab onto the responsibility to just log in and go through this. It's just that easy. It's secure. It's safe. It's community. So what do you think, Amy? Is there anything I'm missing?
I think we pretty much covered the most of it. Sometimes things are just so robust that they're overwhelming,
Right.
and sometimes you just have to get in it and live through it and watch it grow, because it is dynamic, and a lot of the things we're discussing are not there yet, but will be there, and the intentions are there. The design is quite flexible, so it can change and be redesigned. So I think we've pretty much covered why it's needed, what is needed, when it's needed, who is wanting it, how it can be designed, and I think we pretty much covered all of that.
Nice. What
Yeah.
do you
And
think, Kayleigh?
I think maybe if it would help break it down, I can
Mhm.
more clearly state what is there right now and what's coming.
Yeah,
Um, and
do that.
so what's there right now are these surveys that will tailor content to you. So if you talk in your health history about having depression, you will see articles related to FSHD and depression, or resources on depression and your insights and recommendations. Or for example, if you wanted to scroll through all of the recommended articles on scapular fixation, you can search scapular fixation and they're all in there. So a lot of content is ready and available at your fingertips, and it will be more personalized to you as you answer more questions. This daily tracking of your symptoms is available today. Quarterly tracking of your symptoms is available today, and as well as community polls, which is the ability to answer and pose questions to the community that you're curious about, of have you tried this supplement and has it helped you? That's also available today. So things coming in 2025 include more of a tangible physical report of your data back to you. And again, we're actively recruiting people for a focus group because we want to know what you want this to look like. And I will also say that another item that's going to be released very, very soon is research opportunity matching. And so we've done a little bit of that because we have had a few companies reach out to us. And so we've had a few of those inquiries already, but once we have the full clinical trial matching, that's going to be available hopefully by the end of the year. And it's going to show you, again, based on your survey answers, here are the trials you might be a good match for or a possible match for, or the trials that you're probably not going to be a match for. So that is coming very, very soon. And I'm trying to think if there was anything else. Oh, the provider search tool. to look for
Yes.
doctors around you. That is coming in 2025. So
That's exciting.
that clarifies things.
And where does someone sign up for this?
Oh yeah. So all you need to go do is just go to BetterLife FSHD.org. Oh man. Oh, I'm gonna re-say that again.
No slashes any slashes in there, forward slashes?
No, ma'am. So it is just
Yeah, go ahead.
BetterLife FSHD.org.
Yeah, that's it. And if you find it, I mean, if you go to FSHDsociety.org, there is links there. It does get you there too. But yeah, the direct approach, information is all out there. That was good, Amy. You made sure that she plugged it. You got to do that, right?
Thank you. Thank you.
Got to plug it. You got to have that final where you find, information. No, that's great. And the time that you've both put into this, the effort, the energy, it's felt. I can feel the passion through this call for sure. I'm excited. I mean, this to me is groundbreaking help, in my opinion. It's just I went through this. I logged in. It was simple. It was easy. When I saw the feedback coming back in articles and things, I'm like, what? This is wild. There's no more like searching Google. Like Dr. Google is not going to help you. It's like this kind of narrows it down. It's our community. It's built for our community. I love it. I love it. So thank you both for being a part of this episode, getting the word out here as we launch into 2025. Hope is there, promise is there, and I think this is definitely a key piece of all those. This is great.
Great.
Thank you.
Thank you, Tim.
So thank you, Kayleigh and Amy, for joining us on this amazing episode as you introduce more details to us of Better Life. It was a big conversation. I warned you in the beginning. That's what it was. So much fun to talk to them, bring them in here, and really explain the details of this. Like I mentioned in the beginning, I mean, I've already logged on and started doing this myself. It's easy. It's informative. I love the feedback it gives. I'm kind of a survey geek, so that's in there. Articles and things that based on my questions that I gave it at the end gives me some keys to help and guide me through maybe what I'm dealing with within that given time that I logged in and answered these questions and so on. And then, of course, the big picture is the data is going to help our community in general. Data collection always helps, and research to help us find a cure. Takeaways in this episode, man, takeaways are every time I have had a guest on, right? Most times I start with, what's your FSHD story? I want to hear about them. I want to get deep into, the diagnosis, what they were like throughout the process and so on. I say, share your FSHD story. This Better Life FSHD says it'll take control and help you take control of your FSHD story instead of it always taking control of you. I love that. I love that turn of what we're doing to it. It's kind of like turning it on its head, and we're finally becoming maybe the aggressor to some degree here and kind of getting control of our life with this platform. Kayleigh's phrase helps you back, right? That's the nugget, man. It helps you back. Finally, a platform that you don't just give your information and where does it go? Did that even do anything? Did it help? Where did it go? Who has it? This is secure and it helps you back. Instead of just taking the data, that's all the feedback you get, or maybe you get like a pie chart only and that's it. This actually will help you back. And that's just a little bit of what it's doing right now. The fact what it can do for you even later, and there's promise of it growing even further as we move forward in the future of this disease. I'm fully hopeful, and that was the other key takeaway is hope. This gives you hope and control. But I'm very hopeful that there will be a cure. I know this past year we've had our bumps and we've had our bruises with fulcrum and so forth. But I think this is a step in the right direction. This is a step in the right direction. We always have to keep pushing forward. Always pushing forward. There's this mantra that I've been trying to adopt in my own life, and to me, this kind of fits it. And it's based on a book that I've read. It's called Row the Boat. And the analogy is this. You're in a rowboat. It has to be a rowboat. In a rowboat, you face backwards. You don't know where you're going, but you can see where you've been. You have to work in balance with one arm and the other. As you can imagine, those that have never rowed a boat or can't row a boat, that's not the point. The analogy is the point. But when times are tough, you row. When the times are easy, you row. And the times in between, you row. You just row. You keep going. You keep pushing. Fulcrum, negative, we roll. We just row. Row away. It's not just a song for kids, row the boat. No, it is an analogy of your life. How many times have you hit a wall, but you row? You row anyway. You keep going. You don't have a choice, do you? You don't, really. So you might as well. It's kind of like when I go to the gym, man. It's going to hurt if I do, and it's hurt if I don't. So I might as well go. It's going to hurt anyway. Hell with it. And I know we're all searching for that control of our FSHD story at this point. We want to know what's going on. We want data that's going to help us. We want a platform that's going to give us help back. This offers that. So I hope that you follow the links that they shared at the end of the show. FSHDsociety.org. You can learn more information. If you want to talk about this episode or past and chat with me, email's the best way. Or if you got great guest ideas or show ideas, I'd love to hear them. Fill my in basket. FSHD radio at FSHDsociety.org is where you can find that. Don't forget to follow the show wherever you follow podcasts and rate, review, all those things. We need to climb the sucker up. I want people to know about this show that don't even know about FSHD because they just love hearing the stories that you bring as a community to this platform. That would be one of my biggest wishes, right? The non-FSHD community people are actually listening to this. Like, this is interesting stuff. This is fascinating. This is fun to listen to. These are great people. Highlighting the community, that I believe is what FSHD Straight Talk has been doing, and I'm happy to be a part of it. So thanks again to our guests today, Amy and Kayleigh. Thank you to FSHD Society for helping through this podcast platform and supporting it as it does. And we'll see you on the next episode of FSHD Straight Talk. Take care.